Welcome back to the Plowbois podcast, episode 8. I got my familiar once again, that DOC, riding around interstate skating. I got that K-Dog with me. I got that B-Dot and Young Kai Beats. And we talking cold.
On my money, what else am I gon' think about? Forever Southside, some say I'm foreign cause I like to play nard out through morning. Hand on my wood grain, turning up that bub like somewhere around 9. Pac was dropping thugs like scratching in my Scarface. From plots and schemes, made a track with some legends. Shout out to Willie, he never stopped to dream. I'm sleepwalking to the cream, from the cradle to the grave. I'm whatever Houston need. I'm not cocky, I'm not mean. I'm sitting stocky on 19s.
Y'all know one thing. COVID is a topic that we all are dealing with at this time. Indirectly or directly. It's the elephant in the room, fellas. We're going to revisit it tonight. We had a podcast where we gave our thoughts on the vaccine and where we thought things were going to be headed. I thought this would be a good time now that they got all these mandates coming about and the government starting to force people in indirect and direct ways to get vaccinated. So I posed the question tonight with what's going on with COVID right now and the increased cases. Everybody's in a stir. Everybody's in kind of like a mad dash to save themselves or protect themselves. Either vaccinations, masks, distancing, whatever it may be. Why don't the public and the government have the same energy when it comes to health, when it comes to fitness, when it comes to boosting your immune system naturally to protect yourself from all sorts of diseases, diabetes, cancer, kidney failure, whatever it may be, things that can kill you in the long run? Why has this panic caused us to centralize our focus on the now and not look towards what we can be doing to prevent this ourselves from something else occurring in the future? If it ain't COVID, it could be something else that take you out. So I posed the question. I'm jumping right to you, B-Dot, to my left.
All right.
The same energy that we giving this vaccine, the government is giving this vaccine, the same energy, the mask mandates, and all that we've been through since early 2000, mid-spring, up to now, 2021, August 24th. Where's that energy when it comes to health, fitness, and boosting your immune system the natural way? Speak on it for me.
I mean, there was never a focused energy on doing that at all. You know, anybody. I mean, any physician or healthcare provider that does preventative medicine does not have the same amount of leverage in the industry as physicians who treat sick people. And so one of the things you touch on, one I like to touch on is, like, your question is answered with one thing. Healthcare, the name itself, is deceiving. And I'm from healthcare, so I've said this for a couple of years now. Healthcare is not healthcare. Healthcare is actually sick care, because everything in the healthcare industry, what's labeled as healthcare, is focused on treating people when you're sick. All right, so you go to the doctor when you're sick. You don't go to the doctor to prevent sickness or illness. You go to the hospital because you're sick. You're not going to the hospital just to visit and say, hey, I'm here to do my wellness checkup. and then prevent illness or things to come. So from the beginning, it's a big deception. Health care is actually sick care. And you can see it. I mean, even from a as you all know, I was a fitness trainer. So even from that standpoint, you can get insurance companies to pay for your sick care, but you cannot get an insurance company to cover you just to provide wellness or to provide a gym membership. You have to pay for a gym membership privately, right?
Right.
And so until we get to a point, and that actually leads into the food part of it. You know, that's a whole nother subject, but the healthcare, sick care issue is the one thing that I always did have a problem with. It was one of the biggest things I had a problem with in my healthcare career. But even if you get into the food situation, it just gets worse, because we talk about it all the time. A Whopper is 99 cents. Some blueberries, if you try to get you a carton of blueberries, you're paying about $10 for them, you know, $9.99. And what we know is the Whopper sells more. Why? Because it's cheaper. It's higher in fat, it's higher in fat content, it's higher in all the unhealthy elements of eating. So to keep this short, that would be my first problem with the healthcare, sick care label. And I'll let somebody else talk on it after that. But to answer the question specifically, it's so many different things that you could tap into to say why. We don't know why. What we know is that the system is in place to be sick care and not necessarily health care.
More as a reactionary,
Yeah.
treating the effect instead of the cause.
Correct.
Good point. I think it has a lot to do with money. I think K-Dog has spoke on this before. There's more money in treatment than there is in preventing, and we aware of that. So I'm gonna chime in, and then I'm gonna pass it over to you, Kabis. Man, look, government really not gonna be able to mandate what we eat at this point. We don't know what the future holds. They not gonna be able to mandate how much exercise we do, how we live our daily lives per se, how much sleep we get. That got a lot to do with wellness. They won't be able to mandate those types of things. I think that goes back to a personal responsibility. And each one of us have to take on accountability for the things that we do. You know, y'all brought up something this week. We was texting about smoking. Big Doc said smoking is just as harmful. And he's right. He's right. It's almost like we become numb to the things that's wrong, because that's wrong for our bodies. Like B Dot brought up, fast food, hurting yourself eating that on a regular basis. We become numb to it because it's become the norm. It's become an acceptable practice, and that's a not necessarily a healthcare problem. That's a personal problem. That's the people that's intaking the cigarette, or the fast food, or the lack of exercise, the lack of sleep, whatever it may be detrimental to their health. What I think that each of us need to do in a time like this, seeing as the big stir has gone to saving ourselves or protecting ourselves from getting sick, preventing the COVID virus from taking us out by wearing masks, by getting vaccinated or whatnot. There's other measures that we can take. Being healthy, eating healthy, doing the things that we need to do to prolong our life before COVID was even noticed, is something that we can all adopt. And that needs to be the push. Just as much as the protective measures that we deal with on a day-to-day basis. Masks, vaccinations, all need to have a push in order to do what's right. Because as what's been stated, what good does it do you to go get a heart transplant and go eat at Dunkin' Donuts right out? You know, go get dialysis and go get a fried plate of food right after. You're defeating the purpose. So in what we're dealing with right now, we have to adopt new practices. This is something that, like we've all stated before, it's a new norm. It's something that we're gonna all be dealing with one way or another. Whether or not we get sick from it, whether or not somebody we know gets sick from it, whether or not we get mandated to do something that we don't feel we should be mandated to do, we are all dealing with it in one way, shape, or form. What can we do outside of the mandates, outside of the virus that's going around to protect ourselves in the long run? That needs to be accountability by the person, by the individual. I think that you speaking about health, speaking about exercise, speaking about a preventative factor more so than a reactive factor. The vaccine is reactive. This has come about because of Corona. But now that Corona's here, what can we do to prevent ourselves and boost our immune system from the detrimental effects of any virus or any disease that we might come in contact with? Kabis, go ahead and chime in on it, my brother.
Yeah, man. I mean, I agree with what B-Dot said, but I agree with what you said too. And like for me, basically having COVID this past the week and a half type deal, it really just solidified my original opinion of it. Because it's like you got really three factors. You got the actual disease, what the disease is, what it do, who it affect, and how it affect people. You got the government that's trying to kind of regulate everything going on around it. Then you got the vaccine that's coming, you know what I mean? Some already have it, some don't. So it's kind of like this perfect storm of everything moving together. So like B-Dot was saying, it's not about healthcare, it's about sick care. And on the one hand, it's like you have this disease, which it have a very low mortality rate. So for some people, like for me, for myself, I had it, when I had it, I was like, oh shit, I got COVID. You know what I mean? I'm like, damn, what it's gonna be like? But then in the back of my mind, I'm kind of like, well, it's all right, it ain't that bad. But when you're going through the symptoms and stuff like that, you think about a lot of shit. So you're like, well, my family, you want to stay away from your wife and your kids, you want to stay away, you don't want them to catch you. Then you think about, well, it's not that bad now, but what if it get bad later on down the line? Then you know what I mean? You start feeling better and you kind of like, man, this ain't shit, you know what I mean? But it's other people in certain demographics where they may get it and then it's like it's straight downhill for you. So for those type of people, the vaccine, it might be necessary. They might feel like, hey, I got to get this vaccine. I feel like a lot of people, they should protect him. Because like you see a lot of memes and stuff like that where they do peeing on the other dude. So it's like if he got his jeans on and he pee on himself, he just piss in his jeans. If you got jeans on, he just this and that. And I'm like, it's kind of ridiculous. It's kind of like, to me, a lot of the stuff that people say is really childish. Like if you wanna get the vaccine, get the vaccine. But if a person don't want to get it, they shouldn't be like villainized or labeled like they don't care or they this or they that because they won't get the vaccine. I feel like with B-Dot, I agree with what B-Dot saying because your personal health, anybody could say anything about anybody. If you drink a big gulp soda, people could be like, you don't care about your health. Look at that. If you eat a cheeseburger, if you eat fried chicken, people, oh, you eating fried chicken. Look at you. Look what you doing. So it's like that whole aspect built around it, I feel like it's kind of detrimental to the actual kind of getting the disease. And I really don't feel like you can't get a disease under control like that. It's like cancer, anything like diabetes. It's gonna always be there. It's gonna always be something we gotta deal with because it's there now. But like with diabetes, they could outlaw sugar. Crack is illegal, cocaine is illegal. And they tried to outlaw sugar and once upon a time, but they lobbied and had it. Sugar is more addictive than nicotine. But sugar is like a mainstay in like the food industry because at the time when they was trying to write the law to limit the amount of sugar that could be in products, they lobbied and got it on the books to where they basically can't outlaw it. So it's like then the third part, what I want to bring in, the government bringing in, trying to say, okay, well, if you don't get the vaccine, then you can't do this. And then kind of giving preferential treatment to people who do get the vaccine. And it just builds this divide and this wedge when it should be a personal choice, to where if you decide to get it, you get it. If you decide not to, you don't. And it really don't, like herd immunity, that was supposed to be a big thing, but that's just kind of like don't swept under the rug that nobody really want to speak about. But I feel like that's the best course of action. If you feel like you should get the vaccine and that take care of you. If you don't, eventually you're going to come into contact with it, get over it, you know, and then that way everybody been exposed to it, and that'll bring it, you know, like they say, herd immunity.
Word. That's some good points you bring up. Very good points, man.
I ain't sure.
Like you said, that herd immunity. I think we gotta get it right now mentality as a people, and we think the vaccine like was gonna be just rain down from heaven type of cure all, and we see that it's not. You know, there's some long term effects from you know, this virus that's mutating and that's going on right now. So it's not going to change anything overnight. Just like, as they say, anything worth having is worth working for. That means something. You know, we gotta build up our immune system. We gotta do the thing and that's what I meant by this question. Like, why isn't the push, as well as the vaccine? They pushing that, we know. But why? Why isn't the push for us to get healthier? Why isn't the push for us to change our eating habits, to change our exercise habits, to do things that will benefit us in the long run? Why?
People won't do it.
People won't do it. They can't mandate that. You're right. That's a personal accountability thing. A personal accountability thing. K-Dog, you got something to chime in on right now about COVID and the vaccine and everything that we're dealing with right now?
Yeah, man. Coming from a small town, small community, where out here we've got two schools. We've got a school that goes from kindergarten to 4th grade, and then we got a school that goes from 5th grade till 12th grade, till you're a senior. Actually, on today, they decided that they were gonna go ahead and quarantine the entire 5th through 12th grade. So if you attend this school, you're now on virtual. You can be doing virtual for the next 2 weeks as of right now. That may change later on once they see what the numbers are doing, or your primary care physicians are showing they having an influx of younger kids. They may push back the virtual a little bit more. But as of right now out here, that's how it is for your 5th through your 12th grade. Another thing I wanted to add in is, as far as my insurance company, the insurance company that I have, and I have Humana, they pay for preventative care. They also pay for a gym membership for me.
Well, plugging Humana in there.
Yearly wellness exams and different things that come along with that. They also give, they do a lot of things that I benefit from.
Hey,
things
that
help.
Breaking us off, man. You're gonna have to get Humana on the phone and get a plug.
Just things that help me.
Humana pays for a gym membership for you where?
It's different choices that you have, but it's through the Silver Sneakers program is under Humana. Now, the gym membership that I have that I don't even use, I signed up for it, is at the Kashada gym in Kinder, in Elton. But it also does pay for one, I believe it's some fitness place in Eunice, but I haven't gone. I'm signed up for it. I have the gym membership, but I haven't went out there and used it in the way that I should have, in the way that me being me trying to be more healthy, to where I could have benefited from what this company has given me.
So you have to cut K-Dog off, but Garrett, that answers the question right there. And just to point that out, that's my little brother. I love him. It's no discredit to him as a human being, but listen to what he just said. All right, he has something that he knows provides that preventative type measure, and he ain't gonna do it. He never even used it, right?
And that's my point. Correct. That's my point. It's a personal.
Correct.
It's a personal accountability. They won't be able to mandate that. They won't be able to mandate how much sleep we get, or how many push-ups we do, or how much hamburgers we eat. Huh?
And that's the real question. They won't mandate that, but they will mandate something else. So to the person who does take advantage, of those things out there, why do I have to do something that I don't want to do when he's not utilizing those things? And he, not K specifically, but the unhealthy population is being pushed to push that position, or push the healthier person who does take advantage of those options. They're pushing that vaccine as a mandate. So for me to have to do it. Why is that? Why, if you don't have to work out, why I got to take the vaccine? If you don't have to eat healthy, why I got to take the vaccine?
I've always said that it should be a personal choice. I've never said anything different. And I vaccine all week, bro. And we've been talking about how we feel about people that don't get it or whatever. I have never ever. You can't look back on what I've stated and said somebody should get it. I've always spoken on what I did if I was asked.
Yeah.
But I've never even asked nobody to this very day.
Yeah.
I've never asked nobody. And the way I feel about it is this. You shouldn't be forced. But I don't make that decision, man. And the government and the influence that's making that decision shouldn't be put on the people that have gotten vaccinated. It shouldn't be like reflected on, oh, well, y'all got vaccinated. Like, kind of like that mask thing that we kind of had that discussion about. They was mad at the people wearing masks because of the people that mandated wearing masks. That don't make sense. You gonna go snatch off their masks, but they didn't make us wear masks. So it's kind of like the vaccination. It's like, okay, we gonna talk about the vaccination. We're gonna talk about why you shouldn't get it, and then we're gonna end up basically saying all the people that then got it shouldn't have got it, or they should have, they following behind, they like sheep or whatever it is, and then at the same time, you not really speaking on the people that's mandating. You just speaking on the people that then did it, and it's like they not making the decision as far as that mandate go. Nobody made me get a vaccination. My job didn't. The government didn't. I walked in there. I signed my name on the dotted line and I said, look, put it right here. Which arm you want? Put her here. Put her here. Put her here. And I gotta live with that. That's my choice. But I don't need nobody sitting on the other side of that telling me who didn't. Just like I won't say, shame on you. You should have did this. You should have did that. You'll never hear that come out of my mouth.
Yeah. G, but that's you though. That's you specific. That's you. And it's a lot of people. It's a lot of people on both sides. Like you say, it's people who didn't get it, who call people who got it sheep, or you just doing it whatever the government make you do. And you got people who got it. It's a lot of people like I went to school with, and they like, oh, you like they call you dumb, or they like, oh, you dumb, you this, you bad, you conspiracy theorist, you don't want to get the vaccine, you scared of the vaccine. The FDA didn't approve the crate challenge. The FDA didn't approve the lean you drinking, whatever. So it's like, it's people on both sides that have
that
something
goes back to the wrong people. You know, I've been doing a whole lot of soul searching on your circle and who you allow to be in your circle and influence the words that you speak and what you say, man. Your whole demeanor can change when we talked about this in social media podcast. Your whole demeanor can change when dealing with the wrong people. The wrong people can lead to you being controlled. Now I know this mandate has a lot of pressure on people that don't feel like it should be mandated on them. It's got a lot of pressure on it. But don't blame the people that have gotten a vaccination because of a government mandate. Don't blame the people that wear masks.
But that's what I'm saying. That's them. There's the same thing what you saying. That's the same thing what I'm saying. Because I haven't never said nothing to nobody that got to wear a mask. Them people, that's what I'm saying. Them people, they irrational. They mind frame, they not thinking clearly. Because it's like you say, what do somebody else wearing more? Somebody being upset if people don't wear a mask, if people don't wear a vaccine? Because from their perspective, they say, okay, well, you're not getting the vaccine, you're not wearing a mask, you're not taking precaution. Same way, like if somebody driving, he don't got his seatbelt on, or he, whatever.
That ain't got nothing to do with me.
Understand that more than somebody being he got his seatbelt on, he don't trust that the brakes don't work in his car. You know what I mean? But at the same time, it's still, the fact remains. If I get the vaccine, I can still get COVID, I can still pass COVID. So it's like, for me, it's to each his own. Everybody, like, in the Constitution, you have, well, not the Constitution, but you have free will. You got your right to decide. If I want to do it, I'm gonna do it. If I don't, then I'm not. And people shouldn't be demonized on either side. But for me, it was a dude, he got a little video is about, think about if it's a car company. If the government make a law that say we can only have electrical cars, and they say, okay, I'm gonna get these three companies to make electric cars. You can't get sued if your car malfunction. You can't get sued if somebody get hurt in your car. You can't get sued for it. We're not gonna test it. We're not gonna do no kind of testing. We need to get them in the market right now. So y'all just go ahead and make them and just go with it. So what do you think them car companies gonna do? You think they're gonna do research and development? You think they're gonna do safety testing and all of that? No, they just gonna rush, try to hurry up and get it out as fast as they can. And that's what they do.
That's a good point, man.
I agree with what he said. That's your approach, G. See, that's how you think. And you've never said that, but when we discuss it, a lot of times when I bring the topic up, I'm talking about what's happening in the general public and how, like you said, those people have masks on, and the people that didn't have masks on, they are going after them because they're saying you didn't protect yourself and I'm wearing a mask. You should be wearing a mask. But the person who has the mask on shouldn't be worried about the person who don't have a mask on because they have the mask on to protect themselves. So what they're saying,
it was the other way around. It was the other way around. It was the actual people that didn't have a mask on that was mad at the people who had a mask on. That's what I was saying. They do snatch the mask off somebody's face.
Around too.
And everybody's taking notes, buddy.
Put your mask on.
Get stuck in that bacteria. How do you like
Put your mask on.
Then we know who you are. We know who you are. No more masks.
Keep it calm. Keep it.
Yeah. That's what I was saying. I was like, how you justifying that? You was telling me the reasons behind that, and I was like, how you justify snatching a mask off somebody's face? How is that hurting you?
Because they irrational, bro. That's what I'm saying. It's been confrontations the other way. So they like, you gonna try to force me to wear a mask?
But we can't justify irrational, dog. We can't justify when we get in the business of justifying irrational. We become irrational.
I'm rational.
My personal choice, I haven't gone out there and did like I needed to do. As far as the vaccine goes, I am fully vaccinated. I chose to try and protect myself as well as my family by listening to what they said the vaccine can do for you. Now, they don't have any long-term results of what can happen yet, you know? We don't know this. No, I went out and I took a chance of me saying that I wanted to be 100% vaccinated. A lot of the reason was because of my mom and
His
my dad. My mama really was on my ass on she just wanted us to get vaccinated. She wanted us to be them berry women. She wanted us to be vaccinated. I kind of got tired of her being on me, so I went out and I did it, you know. But I don't know. None of us know what the long-term results are gonna be, you know. Now they're saying 8 months from now, they want you to go and get a booster. You know, we just don't know yet, you know. But I chose to try and do the safest thing that I could do at that time, and that was to just go and get vaccinated, you know. As far as the gym membership, I know I need to go. I know it would benefit me, and I know that something like that I could grow from, you know, and probably help others to grow. But I do think that it's something I definitely need to start using because I have it. The opportunity is right there for me.
We got to do all we can, man. Every step of the way, we got to do everything that we can to.
Hey, I just want to say, now look, we got somebody trying to show off. You want to try to get on the podcast while he in the gym.
That's what he do.
We got DOC. I'm gonna reiterate the question real quick. The question is, why has the push been so hard for the vaccine and not for other measures for us to prevent illness and long-term health problems? Speak on.
Because it's big money in obesity. You got these kidney dialysis places popping up like Burger King on every corner. They will not shut obesity down. They don't want to shut obesity down. They just all this COVID come about from China, trade war and all that. That all popped off. Now, it got out of hand. So people dying, they shut down the economy. But then they had to do something to come up with a vaccine. I took the vaccine. But now they telling me, well, you take the vaccine, you don't have to wear a mask. And you can go out in public, you can go to the casino, what I like to do. Now they telling me I got to wear a mask. Well, what is it, Dr. Fauci? You come up with some new bullshit every fucking week, and I'm not having it, bro. I'm not taking another vaccine. I'm not taking a 5th dose. Because by the time that 5th dose comes, we're going to be walking around like some zombies out here. That's my opinion and on the vaccine. I took the vaccine. I'm 55 years old. And somebody young, healthy, work out. I walk, jump rope. But you have to eat apples. You got to eat fruit, bro. That's even before COVID. I was eating healthy. I don't need COVID. I don't need a disease or a virus to tell me I need to eat healthy, because there's other stuff that eating healthy takes care of, not just COVID. So it's big money. It's big money in diabetes. It's big money in high blood pressure. Heart disease. It's big money in that. They won't make people stop smoking, because of cancer is big money in cancer and lung disease, secondhand lung disease. Hey, we can get people to secondhand smoke in here. We can make money off. We kill 2 birds with 1 stone. They will not stop people from smoking in public, but they'll try to make somebody go get a vaccine for a disease that's 99.5%. It's something like that. Death rate. You don't hear nothing about nobody dying with the flu. People used to die with the flu. Bernie Mac died with pneumonia, but no, now everybody, they gonna blame COVID. That's my opinion of the deal. But like I said, that's my analysis of the deal.
Straight up, baby. I respect that opinion. What should we be doing? Going straight to the BUCK. Talk to me. What should we be doing, man? They're telling us we got to get a mandate, a vaccine. They telling us we can't go this place, we can't go that place without it. They telling us we got to wear the mask, we got to stay 6 feet. What can we be doing? Where's the big push to eat healthy, to exercise, to do all the things to prevent what causes these comorbidities that's killing people with this virus, man? Where's the big push for that?
Man, first of all, it's way, way, way too difficult to get people to get on board with healthy living in the United States. We're not designed that way. Our food system not designed that way. Everything is designed for economic, profits and stretching. That's why we got processed foods. That's why everything is stepped on. So, man, so from a government standpoint, man, it's entirely much easier to just do a vaccine for everybody to go get a quick vaccine. Like you ain't gonna get everybody on board with going to the gym every day, going eat right, cutting out alcohol and smoking and things like that, or moderating those things. It's gonna be damn near impossible to get everybody on page to do that. So, of course, this is what we should do. But, I'm gonna go back to, I'm gonna use your little term. Man, I can only do what's best for me. So what everybody else gonna do, they doing their best choice. They doing what's best for them.
Personal accountability. What you talking about?
This is what I can do for me and the people around me, and be an example and them to see like, hey, this is what's up. I feel great. I mean, I feel like I still living in the same world I was living in last year before last. But I mean, in my world, I'm like, yeah, people getting sick. People get sick all the time. You know what I mean? It's like, and another thing is too, man, life's too short.
Yeah.
For me not to live the way I want to live my life every day. You know what I mean? Like if I die tonight, then that's it. Then I'm done. I had a good life. I had a good run. It's over with. Like I ain't, but wearing a mask and all that, I wear a mask. I go inside of a facility or if they require me, I don't mind putting that on. I know how to follow rules. So rules don't bother me. The PPE, I wear PPE at work. I wear safety glasses. Well, I'm used to that. That's not no problem. But as for taking an injection or taking some sort of medicine or anything like that I don't want to take, I feel like I got a right to not to take that. You know what I mean? Like straight up. I mean, that's for me. You know what I mean? If I had cancer or some other kind of, I'm gonna take I'm gonna take the treatment for that. I'm gonna take what I can take to help me get better. But if that ain't the case, then I ain't taking nothing. I ain't doing nothing I don't need to do. That's me, man. Like I said, it's pretty simple for me, dude. Oh, shout out to the Buck and Duck water right here, swamp water in the building right here. Get you some of that. Coming to a shelf near you right there. That's all you need. That right there, secret ingredient.
You got the vaccine in your hands, boy.
The vaccine right here. One scoop of that. You straight. You in the building. Secret serum.
We can't see you, man. You got to get on the gym Wi-Fi, bro. Pay him a few more dollars so you can get on the get the code and get on the Wi-Fi. Cause you over there, we see a still shot. And we see you talking, but we hear you, dog, loud and clear.
Man, I'm in hey, bro, I'm in Gladiator School. I'm in a dungeon right now. It's probably 10 buildings. They ain't got no service. I don't even need no service. Like it's all. I'm right here.
You in the bunker, dog? You in the bunker?
I'm in Gladiator School. So
a Plowboy will survive, man.
That's right.
A Plowboy will survive. I think we all chimed in. B-Dot, just to recap, you put it from a healthcare standpoint, like Kenny said. He reiterated what you said before you got on, that you ain't gonna mandate America to do what's right. You know what I'm saying? And we are, and like I put it, we are a get it right now society. We want the results now. We don't want to work for what we get. So we thinking that this vaccine is the cure-all, and then when it ain't, you know what I'm saying, you get this big uproar about all the booster coming. Why is the booster coming? Why we got to do this? Why we got to do that? But the whole time we could be preparing our bodies if we do catch it. And Kabis firsthand brought it to an effect of somebody who dealing with it firsthand. You know what I'm saying? Him taking care of his body and taking accountability for what he got to do. Not knowing what tomorrow gonna bring. Buck said it himself. Tomorrow's not promised. So do all we can to protect ourselves, to live life to the fullest now. K-Dog, you said what's going on at your schools is all up in the air. They home now. You don't know how long they're gonna be home. They say 2 weeks. It could turn into 4 weeks. It could turn into a month. Who knows? Tomorrow's not promised. We got to do everything we can to protect ourselves. And if we feel like what they asking us to do is infringing on our rights, then dog, that's something that we got to tackle as Plowbois as it comes. We got to tackle it as it comes because things are changing. Things are changing. But what ain't gonna change is the man upstairs. He's the same he was yesterday as he is tomorrow. And I ain't gonna debate you. I ain't gonna debate you on what he can do. But I know he got more medicine in the hem of his garment than any vaccine ever had. So call out to him, man. Remember, he got our back. He'll never leave us or forsake us.
Plowboy, you ain't no city boy. Yeah, you were born with dirty hands. Yeah, you a plowboy, and you're thinking silly boy. Just trying to make you understand. Yeah, you a plowboy, and you're thinking silly boy. Just trying to make you understand. Oh, yeah.
Thanks for watching the Plowboy Podcast. Don't forget to like, comment, share, and subscribe. Protect yourself out there while you plowing the fields. Do all you can.